Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Asthma. Introduction. Asthma is a common disease of the lungs affecting millions of people. This patient education module will help you better understand its causes, symptoms, and treatment options. Anatomy. Oxygen is vital for life. Without it, death happens rapidly. The lungs allow us to fill our blood with oxygen. The air we breathe comes in close contact with the blood in the depth of the lungs. The blood then fills up with oxygen and releases unwanted carbon dioxide, or CO2. When we breathe, the air goes through the mouth and nose. From there it goes to the air pipe, known as the trachea. From the trachea, it goes into an increasing number of smaller tubes called bronchial tubes. Small balloon-like sacs called alveoli are at the end of the tubes. The walls of the alveoli are very thin. On the other side of the walls there are small blood vessels. The thin walls of the alveoli allow the oxygen to go into the bloodstream and also allow CO2 to go from the blood to your lungs to be exhaled. Muscles surround the bigger bronchial tubes. The inner lining of these bronchial tubes secretes special substances called mucus. The mucus helps trap dirt from the air. Mucus is continuously expelled from the lungs. Very small brushes, known as cilia, on the outside of the lung cells continuously push the mucus to the outside. If the mucus becomes significantly big, it is coughed out. Symptoms and their causes. Asthma is a condition that makes breathing difficult. This causes a feeling of tightness in the chest. Patients with asthma are sensitive to certain materials that cause an inflammation or swelling of the inner lining of the lungs. This swelling can cause narrowing of the air passages. The swelling and inflammation of the inner lining of the lungs can lead to symptoms such as difficulty breathing and tightness in the chest. The muscles around the bronchial tubes could also tighten abnormally, resulting in further narrowing of the air passages. When an asthma attack happens, the lining of the lungs quickly becomes swollen. The air passages fill up with thick mucus and the muscles around the bronchial tubes tighten. This greatly decreases the airflow in the lungs and could potentially be life-threatening. The symptoms of asthma vary from person to person. They can be more frequent or more severe in some people, affecting work, sleep, and physical activity. Severe asthma attacks can be life-threatening. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Triggers. Many things can lead to the inflammation of the lungs and abnormal muscle tightening. These are known as triggers. Triggers include substances to which a person may be allergic to. Animal hair or secretions, mold, pollen, and dust are examples of allergens. These allergens can trigger an asthma attack. Extreme conditions, such as very cold or very hot weather, can also trigger an asthma attack. Particles in the air from car exhaust or other sources of pollution, like factories and wildfire smoke, may act as a trigger. Smoking and secondhand smoke are also well-known triggers for asthma. If you have asthma, it is very important that your home is a smoke-free zone. Quit smoking if you smoke, and encourage members of your household who smoke to quit. Medicines like aspirin and non-steroidal pain relievers like ibuprofen can trigger asthma attacks. Food additives, such as sulfites found in wine, can also act as a trigger. Some diseases, such as colds, flu, and heartburn, GERD, can trigger an asthma attack. Getting the flu vaccine may help prevent asthma flare-ups. Stress and bouts of extreme laughter or crying can also affect the lungs and cause an asthma attack. Diagnosis: repeated occurrences of difficulty breathing and wheezing are indications that the patient may have asthma. After taking a detailed medical history and listening to your lungs, your physician may ask you to have a special test done, known as a pulmonary function test. This test aims at determining the ability of your lungs to function. Peak flow measurement is a part of this test that the patient may be asked to perform on his or her own following the visit to the physician. This test allows patients to monitor their own progress. The patient is asked to blow into a tube. A marker on the side of the tube indicates the speed at which the breath is exhaled out of the lungs. A chest X-ray may also be done to screen for other diseases that have the same symptoms as asthma. An allergy skin test may also be done to find if the patient is allergic to certain substances. Treatment options. Asthma cannot be cured, but its symptoms can be controlled. The most important part of the treatment plan for asthma is to prevent severe asthma attacks. If an asthma attack has already happened, the treatment will aim at stopping the attack and restoring breathing to normal as quickly as possible. Your healthcare provider will prescribe a medication that will help stop the attack. It is important for patients to monitor their breathing on a regular basis using the peak flow measurement discussed earlier. This allows the detection and treatment of breathing problems before an acute attack occurs. It is also important to control the triggering factors. Washing pets once a week, getting rid of household items that may accumulate dust like thick carpets and blinds, and the use of air conditioning are all ways to avoid triggers. Avoid smoking and secondhand smoke. Adequate use of medication is also important in the treatment of chronic asthma and the prevention of asthma attacks. Treating chronic asthma usually involves taking medications that will decrease the inflammation of the bronchial tubes and decrease the sensitivity of the lungs to allergens. These medications include corticosteroids, which can be given as pills or as inhalers. Other types of anti-inflammatory medications are non-steroidal medications, such as cromolyn and metoclopramide. To prevent or avoid acute attacks of asthma, bronchodilators are usually used. The aim of these medications is to relax the muscles of the bronchial tubes. Some of these medications act quickly and are inhaled. Others act over longer periods of time and are usually taken by mouth. Even though some asthma attacks can be induced by exercise, exercising under a physician's supervision helps the overall health of the lungs, heart, and body. Ask your healthcare provider about an asthma action plan. Asthma action plans will tell you how to monitor your asthma, how to prevent asthma attacks, what to do when you have a flare-up, and when to get immediate medical help. Severe asthma attacks can be fatal. Learn from your healthcare team what to do when your symptoms worsen and when to get emergency treatment. Signs of an asthma emergency include fast worsening of shortness of breath, lack of relief after using the inhaler, shortness of breath during simple physical activity such as walking. Asthma often changes over time. For this reason, it is important to track your symptoms and follow up with your healthcare team to adjust your treatment and asthma action plan. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Asthma is a condition that makes breathing difficult. This causes a feeling of tightness in the chest. Patients with asthma are sensitive to certain materials that cause an inflammation or swelling of the inner lining of the lungs. This swelling can cause narrowing of the air passages. This can lead to symptoms such as difficulty breathing and tightness in the chest. Many things can lead to the inflammation of the lungs and abnormal muscle tightening. These are known as triggers. Triggers include substances to which a person may be allergic. Animal hair or secretions, mold, pollen, and dust are examples of allergens. Significant advances in understanding asthma and treating it have been made in recent years. Knowing about the disease and its treatment options has helped asthma patients live a better and healthier life. Asthma is an ongoing medical condition. You need to watch your signs and adjust your treatment with your healthcare provider when needed. Thank you for using Explain.